Alpha-1 antitrypsin, or AAT deficiency, is a genetic condition that can cause serious health problems, especially in the lungs. In fact, in one study, emphysema caused the deaths of 72% of people with severe AAT deficiency. It is the most prevalent, potentially fatal genetic defect among Caucasians. Genetic screening is the only definitive diagnostic test for AAT deficiency. AAT deficiency is a genetic disorder. The severity of AAT deficiency depends on whether or not the person has one or two copies of the defective gene. Of the common abnormal AAT genotypes, the severest form is homozygous for the Z allele. People with the PiZZ genotype only have 15% of the normal amount of AAT in circulation, making them more likely to develop emphysema at a young age. AAT serves a vital function in the lungs, where it protects lung structures from breakdown by neutrophil elastase. When lungs are injured, infected, inflamed, or damaged by cigarette smoke, neutrophils release elastase in response. Elastase is an enzyme that helps destroy bacteria and damaged host tissue. AAT is a protease inhibitor produced by the liver that is released in the lungs in response to elastase, keeping the immune reaction in check. Normal levels of AAT in the lungs mean that neutrophil elastase only breaks down unhealthy tissue. However, when the liver does not produce enough AAT, elastase can attack healthy tissue. Elastase breaks down elastin, a key protein in connective tissue. This leads to chronic tissue breakdown in the lungs and ultimately emphysema. Cigarette smoking is particularly dangerous for people with AAT deficiency because smoke increases the inflammatory response, which causes the body to release more neutrophil elastase. Remember that you cannot tell whether a patient has AAT deficiency just by history or physical exam. There are several ways to diagnose genetic AAT deficiency, including genotyping and phenotyping. ATS-ERS guidelines support targeted genetic testing for both symptomatic and asymptomatic COPD patients, including all adults with symptomatic COPD or emphysema regardless of smoking history, all adults with symptomatic asthma whose airflow obstruction is incompletely reversible after bronchodilator therapy, asymptomatic patients with persistent obstruction on pulmonary function tests with identifiable risk factors, siblings of individuals with PiZZ. ATS also recommends diagnostic testing for all patients with unexplained liver disease and adults with necrotizing paniculitis. These tests are available from commercial laboratories and free test kits from Grifols. AAT deficiency is a serious chronic health problem. Up to 3% of COPD patients in the U.S. have AAT deficiency. Only 5% of patients with AAT deficiency have been diagnosed.